Good afternoon. Today we're going to be talking about postpartum depression. Our topic is an advocacy for creating awareness regarding legislation on maternal depression. And you'll see that as we go through our PowerPoint presentation, we do emphasize the social issue and advocate for more awareness because this is a big component of our program that we're presenting today as well. So, without further ado, I'm Rhonda.
And I'm Sophia. So, what is postpartum depression? It's a mood disorder that can affect women after childbirth. There's a combination of physical and emotional factors that contribute to postpartum depression, such as a drop in hormone levels, which can trigger changes in moods. Also, sleep deprivation can lead to physical discomfort and exhaustion, which contribute to the symptoms of postpartum depression. And every year, more than 400,000 infants are born to moms who have depression. Therefore, this is the most underdiagnosed complication in the US today. Some of the symptoms of postpartum depression include feelings of sadness, hopelessness, emptiness, and feeling overwhelmed, constant worrying or overly anxious, experiencing anger or rage, losing interest in activities that are usually enjoyable, withdrawing from or avoiding friends and family, most importantly, having trouble bonding or forming an emotional attachment with her baby, and then thinking about suicidal ideations. Some of the risk factors for postpartum depression include symptoms of depression during or after a previous pregnancy, previous experience with depression or bipolar disorder at another time in a mother's life, having a family member who's been diagnosed with depression or other mental illness, mixed feelings about the pregnancy, whether this was a planned pregnancy or an unplanned pregnancy, if there are alcohol or other drug abuse problems. And it's important to know that postpartum depression can affect any woman, regardless of their age, race, ethnicity, or economic status. What are the baby blues? The baby blues is a term used to describe the feelings of unhappiness, fatigue, and many women experience this after childbirth. Nearly 80% of moms report symptoms that are somewhat mild and last about a week or two and usually go away on their own.
Postpartum psychosis is more severe than the regular postpartum depression. It happens within 1 to 2 of every 1,000 deliveries, and the onset usually happens within 2 weeks of birth. Symptoms include delusions, hallucinations, irritability, hyperactivity, decreased need or inability to sleep, paranoia, suspiciousness, rapid mood swings, difficulty communicating at times. And risk factors for this type of depression include a family history of bipolar disorder or psychotic episodes. And just a little fact here: of those who do develop this postpartum psychosis, there's a 5% suicide rate as well as a 4% infanticide rate. Okay, I'm going to briefly just go over some of the history of postpartum depression. So, as early as 700 BC, there was evidence of discussion about this phenomenon in literature and poetry written by Greek artists and other famous authors back in that time period. Hippocrates was one of them that happened to discuss this issue. Um, Going forward in 1850, It was the first time that medical professionals recognized postpartum depression as a disorder. In the 19th century, women who experienced depression um, kind of hid it away because of the response from society. They were diagnosed with neurotic episodes or disorders, and they were also subjected to very unusual treatments. In 1950, they tried to treat postpartum depression with electric shock therapy, and this perpetuated the stigma and caused more women to hide the fact that they were dealing with this issue. They would feel shameful or feel like there was something wrong with them. And also during this time period is when they would um, put mothers who were dealing with postpartum depression in a mental health hospitals and just put them away. And so, as you can see, there was a lot of stigma, like I said, and shame associated with it. Also, major depressive disorder with postpartum onset wasn't introduced to DSM until 1994. Okay, so we'll talk about this more when we talk about the type of program that we want to have, but just to be able to put it out there now, one of the biggest parts of being a social worker and social work in society is having high ethical standards, especially around confidentiality for our patients and for our clients and even for ourselves. As we go forward, we're going to reveal some things about our own story, about our own lives, and reasons why this topic is so personal to us, something that we chose based on our own personal experience. So we would hope that this would be kept confidential. Yay! This is my story. If you're not aware of my voice, this is Rhonda. So I had 4 children. And I actually didn't experience the full onset of postpartum depression, but I did experience baby blues, which was what Sophia described earlier. Um, it's more mild, and it was something that happened to increase in its severity with each kid. So after I had the first one, which you'll see in the bottom right, you can kind of tell which child comes after the other based on my appearance because I look younger and I look probably a little thinner. But after the first one, I remember feeling this sense of worry and sadness. I was tearful. I didn't know what was going on, but I knew that there was something wrong. It only lasted for about a day, and I was able to, move forward. But as I had the other 3 children, it got more and more severe. And by the time I had my fourth, I knew that something like this was coming. Even though I had a lot of family support, I had my husband and I had the other children, and I come from a culture that's very family oriented. We had a lot of financial gifts at the time, so it wasn't like I was worried about finances. There was no like valid reason why I should have been sad, but it just came on. It was just an onset that was based off of my own hormones and my own, feelings of just, I don't know, sadness, depression. So that was my experience with baby blues.
So, this is my story of postpartum depression. I had my son in November of 2012, and I felt overwhelmed, overly anxious, irritable, and I was constantly worried about how I was as a mom. I knew the issue was major when I began having thoughts of suicide. Some risk factors that I had were existing depression, stress during my pregnancy and immediately after birth, the fact that it was an unplanned pregnancy, and I had no emotional support from his father. In fact, 5 days after his birth, I was dealing with court issues regarding custody. When my son was around 3 months old, I called my doctor crying because I was breastfeeding and I didn't know what was going on. He suggested that I was having postpartum depression and offered medication. I had mixed feelings about this, and I discussed that with my doctor. He put me on a low dose of an antidepressant, and it wasn't overnight of a transformation. And still today, I have a struggle with postpartum depression, even though my son is 3 years old. I am passionate about postpartum depression because motherhood should be a blessed experience. So, Bringing Postpartum Depression Out of the Shadows Act of 2015 is a bill that was introduced July 2015 by Congresswoman Clark of Massachusetts and Costello of Pennsylvania. It would authorize the funding for the screening and treatment of maternal depression. Some of the goals and objectives is to provide training to healthcare providers and resources so that they can connect mothers with community-based resources and follow-up support. It would enable healthcare providers such as OBGYN doctors, pediatricians, psychiatrists, mental health care providers, and adult primary care clinicians to receive or provide psychiatric consultation in person or remotely in the treatment of pregnant and postpartum women. It also introduces public awareness campaigns, funding for startup costs, and establishing linkages between community resources that includes mental health resources, primary care resources, and support groups. The bill is suggesting a $5 million grant for each fiscal year beginning 2016 through the year 2020.
Okay, that leads us to our program. So we haven't developed a name for what we would want our program to be called, but definitely our emphasis in our program would be on advocacy and awareness, education and support. So as I mentioned before, we want to be able to go and tell our story and not feel ashamed about it and encourage other women to be able to share their story as well. That's part of the awareness and advocacy. Our program would lean heavily on collaboration and mutual consensus with other local programs. We would reach out to organizations like Chicks in Crisis, Birth and Beyond, the WIC program, and a lot of the programs that were mentioned during our class presentations. As social workers, we all have developed relationships that we hope would go off into the professional world and allow us to be able to make these connections and provide a net of support for our clients. And so, some of the things that were discussed today about housing and helping with homelessness and things like that, those would help to reduce some of the risks that were mentioned earlier when we talked about the onset of PPD and what are some of the risk factors. Additionally, we would hope that our program would be led and decisions would be made by a passionate board of directors, those who have been impacted personally. So, as you've heard here from Sophia and I, we have personal stories and personal investments in this issue. And so, we would hope that a board that would make decisions about staffing, about MOUs and who we would connect with, and relationships and things of that sort would be made by people who had a passion for this topic, just like we do.
May is Maternal Mental Health Awareness Month. This concludes our project presentation. Thank you.
Thank you.